Farming people are often left off the radar in relation to health, wellbeing and safety. We have a perception that they're really a very healthy group, and in fact we're finding that they're not.
Our activity is our farm, it's our livelihood, and we bury ourselves into work. If something gets us down, we just go out and do more work. But before this project, I was like every farmer. You don't go to the doctor unless you're sick. You don't really talk to your friends that often about private issues.
It's not about health professionals running a program on health, it's about bringing farmers together to learn about health, wellbeing and safety.
You're there with a whole heap of other wives and husbands, and they've all got the same issues, and you can realise there's a network out there you can actually talk to later on when you meet them down the street.
The key success for healthy Australian farms are healthy Australian farm families, and that's the impact of the whole program, and that's important for everybody.
Well, with this show we're trying to create an awareness surrounding hepatitis C within Indigenous communities in particular. 1 in 100, the Australian community have hepatitis C, 4 in 100, the Indigenous community, and 60 in 100 in prisons. You know, we just want people to talk about it and to demystify any issues surrounding the disease. Going into communities and going into prisons and performing these shows, people really relate to it because you're going through 15 years of two people's lives in a 50-minute show. Kind of like they're on the outside of the house looking in through the window, you know, rather than, you know, if it's on TV, they're just looking at a screen, they can turn it off at any time, but they're there and they're on that journey with us. When we go to prisons, we see big men sort of sitting there like arms folded, real staunch, you know, watching the show, ready to watch, okay, what's this going to be about kind of thing. And then like by the end of the show they're like, hey sis, you know, it's deadly, you know. No, or I've got hep C and I'm inspired to go check it out. It's when people, you know, are willing to get checked out and, you know, or they're able to share their story with us as well.
We're always taught to respect our elders, and I think often people don't understand that the resources that they receive are really, really low. So a busy emergency department or hospital ward isn't the most appropriate place to meet the medical and nursing needs of an elderly person. It can often in fact be detrimental to the patient by increasing falls, deliriums, pressure ulcers, functional decline and even malnutrition. We take a really holistic approach. We go out into the community, see them in their home environment. We talk to their carers that are looking after them every day. We talk to the GPs that are managing them primarily. We talk to their families, and in doing so we try and put in a very individualised and tailored care plan. Majority of time they would much rather stay in their own home. They don't want to come into hospital. Personally, I'd see it as a privilege to be able to offer them a little bit of extra support and make sure that the end of their life is as dignified and comfortable as it can be.
In someone like Tamara's situation, she was on dialysis and facing a number of more years of waiting for a kidney transplant. And even though she had a donor, the donor was of the wrong blood group, so she was no better off.
Your life's on hold, waiting for that, you know, that call. You can't live the life that you want to lead because you're stuck on a machine every second night. You're wondering, you know, where are you going to be at in 5 years because you don't know if you're going to get that call, you don't know if you're going to get that opportunity.
Building on work of colleagues in the United States, Japan and Sweden, we introduced new technologies into Australia. The medical, surgical and laboratory teams at the Royal Melbourne work closely together to create Australia's first ABO incompatible transplant program.
Reading the newspaper one day and one of the stories was about the first ABO incompatible transplant that was done in the Royal Melbourne Hospital, and Alan, a friend of mine, just said, you know, so when are we getting it done?
We all do our job as doctors, but it's been an extraordinary thing to be part of something that has broken down a barrier that could previously not be overcome.
It's given me the chance to get back control of my life, so now I can work full time, I can just go away whenever I want. everything's happening, we're back on track, you know.